I've just started that on, so it should be, yep, there you go. All right, so that's HotHealth. So what it will look like is within HotHealth, you'll be able to, as a client, as a patient, they'll be able to view the calendar, check the modality, and then see what slots are available, and then basically schedule appointments with the provider on their preferred dates where there is availability. And then that particular appointment will show up within EMR, within My Diary if you're the provider, or within PMS for your staff to view that appointment against your calendar. I see no hands up. If there's any questions, let me know. Feel free to raise a hand. Brenda, your hand up on your video.
So does that mean that's the young person or the external?
Yes. So HotHealth is our consumer engagement platform. So they'll be able to actually go in within HotHealth, see what the availability is based off of rosters for that staff that they're interested in seeing, and then schedule an appointment with them. Yeah. And then, of course, your staff will be able to modify them if required and reach out to clients if there is a change that needs to be done. But you will see that appointment in your diaries. All right. Moving on. The other big ticket item that we've got within our roadmap is ePrescribing. So we are integrating EMR with using MediSecure to provide ePrescribing capabilities. The prerequisite for ePrescribing is an IHI conformance and the registration with the department to get an HPII and HPIO, as well as have a location or minor ID. So those of you who are already doing online claims with Medicare, you're already aware of what location and minor IDs are. But if you're not, then you would need to register with Services Australia and then register ePrescribing with that particular location and minor ID, which you can get from Global Health. So Global Health maintains that list of IDs, but you do need to register that with Services Australia. So that is a requirement. An IHI conformance and HPII and HPIO setup is required for My Health Record. So if you're using My Health Record, you probably wouldn't need to do that additional step. But those are the prerequisites for ePrescribing. We would also recommend that if you do want to take on ePrescribing, that you enable two-factor authentication, which was made available from 796 and upwards. So that's, and so if you're using that, that's great. But when you do want to upgrade to version 8, we would recommend switching to FA on. So there's that additional step and security to access EMR. We will be supporting 3 different workflows for ePrescribing. So creating new prescriptions, canceling prescriptions, and ceasing prescriptions. It'll follow the same kind of workflows that you see in EMR currently. And so we've tried to maintain as much as possible the workflows that you're seeing now, so that there's as little training as you would need to do to your end users. Yep. So, and if you modify any existing prescriptions and you want to send it out again, that will basically follow the workflow that we would sort of create a new script number and would cancel the previous one, so that that particular message goes through via MediSecure to the prescription exchange. Now, we'll also allow sending the SMS token to the client, and what that token means is that when you ePrescribe, how it will work is you've created a new prescription in EMR, and then you saved that and you've printed that. And what happens is that based on the client's preferred communication method, they will either be sent an SMS or an email with the what the department calls it as a token. And what that token is basically a barcode and a QR code, which the client can use and show at the pharmacy, and so that pharmacists can scan that and dispense the medication. And so we will give you the ability to resend that message in case the client has lost it, didn't get it for whatever reason, and needs another message. So it'll be the same, it'll be a reference to the same prescription. So they won't be able to get it dispensed multiple times because it's the same code. We will be integrating it such that there's only prescribing services and not dispensing services in case any of you have dispensing services available in your health services. So these are the screens that you would see if you wanted to either cancel a prescription or resend a token or seize a prescription. So these are existing workflows. Now, this particular section here, the first one on the left, you can see if you right click, you can cancel prescription. And so that message will go through and the client won't be able to get that dispensed once it's been canceled. The client will also get a message saying there's an update on your prescription. And when they click on it, they'll be able to see that that prescription has been canceled. Similarly, from there, you can right click and send SMS, or you can send the prescription again to the client in case they've lost it. So that's the medication grid when you click on prescribe. From within the medication module, you also have the ability to select a prescription and click on delete. And what that delete functionality will do is basically cease the medication. And that message will go through to via MediSecure to the prescription exchange as well. Now, seizing medication will only be allowed if it has been dispensed. If it hasn't been dispensed, you can cancel it, but you can't seize it. And so if you're trying to seize a medication that hasn't been dispensed yet, you will get an error message saying seize cannot be performed as the prescription has not been dispensed. This is what the message will look like to your clients. So when they get an SMS, they'll see that there's been a prescription for tablets with so-and-so dose. And they can click on the link. And once they click on this particular link, they'll be able to see the exact details and even the remaining dispensations. And then they can see the barcode and the QR code right there. Now, this code here that's generated, you'll see it starts with a GLH followed by 5 digits. That's actually coming from the minor ID or the location ID. So that's why it's important that if you're interested in ePrescribing, that you register with Services Australia and then let us know so we can assign a minor ID to you. And support will be able to help you with that if you have any questions. Going forward. Right, any questions on ePrescribing? No, seems all good. I see Dee nodding over there. All right. Next up, MDS updates. I know some of you have been on multiple calls where we've discussed MDS updates, so I want to keep it short and quick as much as I can. We've got some new changes coming in for version 8 for the next financial year updates starting July 22 to 23. And so I've listed all of the MDSs that we sort of support at this point in time. So the ones that haven't released any sort of changes as yet are FMH, HAC, and HMDS. Now, this list is across Australia, so there are some that might not be relevant to you, such as HMDS, it's for WA, and then you'll see some that are like minor, which is Victoria specific. And then there's the federal ones. So FMH, HMDS, and HAC haven't really released any updates that would affect any changes within EMR. We do have some changes coming in for CHSP, NOC, and NDIS, but we're expecting it only to affect the businesses. So you might want to review what changes are coming in and sort of incorporate them into your workflows, and see if you need any additional help setting up the configuration for those items within, say, for example, service items, or I know NDIS is quite heavily dependent on service items. So something like that, where you want to sort of utilize some other features or set up some configuration that is needed. There are changes coming in to 4 of the MDSs that are listed here: PMHC, VADC, VINA, and WAOD. So PMHC, they've released a certain identifier management system, which we're already compliant with, but they also want, they have a reserve tagging system, and some of our clients would like to take advantage of that tagging system. So we will be providing an episode tag functionality in mid-June, so it won't necessarily be available with the first release, but we will be giving that additional feature sometime in June. Then we've got VADC changes. They're simple, fairly straightforward changes to how to record information, some configuration changes. And so we've provided the ability to sort of end date and start date configuration. So if we've provided certain configuration from July onwards, you can set it up in such a way that end users only start seeing it from the 1st of July. And so you don't have to worry about incorrect information being recorded prior to July if you do decide to go live earlier, or if you do go live later on, you can sort of end date existing configuration that you've been using and you don't want to see it in the front end. Then we've got changes coming in VINA. VINA has some changes in validation, some changes in program streams. That additional information is in the presentation that we had earlier, which detailed all of the MDS updates. It has been updated into Zendesk, I believe, and can share that link with you if you're interested in seeing more details. Similar to that is WAAOD. There's been changes in how the data is extracted and in how many number of files, and the kind of information that we want to see every quarter. Those are 2 of the major changes. And then there's additional configuration changes that we've incorporated for July onwards. Those are the ones that are changing. So, but we also do have 2 that we're waiting on the department to give us additional information. So CH, Community Health Reporting, they've mentioned that there will be changes coming in, but they haven't yet released them. They have mentioned that there will be minimal changes to the application, but we'll see how it goes once they've actually given us the details. There's also a bit of change coming in to triage, but again, we're waiting to get confirmation from the department. That's about as quickly as I can go through MDS updates. We've covered that already, so I don't want to spend too much time on there. Happy to answer any questions later on that one, because I know not everyone reports everything. We can probably have that conversation outside and get you those answers later on. There is a question in chat. As you're probably aware, Headspace centers are required to upload MDS from 1st of July. I hope the version EMR 8 is ready for what's required for Headspace centers. Would you share any workflows with us? I can get back to you. Sorry, I'm sorry if I get your name wrong, but I'll get back to you, Sujeevi, on that point. I'll just make a quick note of that to make sure I don't forget. Okay. I've got another question here. So yes, we will be sending through the recording later on. It will be available on Zendesk. All right, moving forward, we do have some additional features coming in with the other roadmap items. And so, as you can see, there's 4 of them that I've chosen to discuss today. One of them being the inpatient day ward view. So what used to be the hospital inpatient tab will now be called the inpatient track board. We've previously released the timeline view, where if you've got an inpatient ward and you want to keep track of who is admitted within that ward and in which bed, you had a timeline view available on there. But now with version 8, we're also making the inpatient track board day ward view available. And so what you can see on the screen here are all of the admissions within that particular ward. And this is similar to what was there before, in the sense that there was limited information before, where it would only list the clients who were admitted within that ward. But now what will happen is you can see the date, you can switch between the days to see who was admitted during that time. You'll also be able to see all of the resources. So if you have beds set up within your ward and you've assigned specific beds to that particular admission and to that client, you can see them against the client information and the admission information. You'll also be able to see whether they have alerts on there or not. And on double clicking on that particular button will give you the alerts window for that particular patient. You can also see their admission information and any estimated discharge dates against them if you've recorded that information. You can also set up labels against these resources. And so if you right click and select a particular label that you've set up, you'll be able to change the color of that particular resource based on your settings for your organization. And that gives you a sort of a visual idea of what you're looking at if you've decided on certain types of color coding. So the dark blues are admissions, but the light blues are basically planned admissions. And the information that you're seeing here is the planned admission information. And so that's the inpatient day ward view. Next up is, so with the 2FA service that you can use with ePrescribing, how we had implemented it was that it was using the same services for SMS as your appointment SMS. So now we've split it out into 2 separate services to improve the messaging services, so that there's no delay or less of a delay when you get the OTP messaging. So if you are using 2FA, we would recommend that you make a note of that, and when getting upgraded, make sure that the services are split out into 2 and you've got both of the services running, and do some testing in UAT before going live. Next up is we are working towards giving you additional audit in admin client. So we've got auditing capabilities within EMR. So if you make certain changes in patient records, you've got that ability to view that auditing. But we've had very little auditing capabilities in admin client. So we're trying to introduce that and give you the ability to see what's been changed, who has made that change, when did they make that change, and what was that change, or what was the settings before the change was made. The first thing that we're coming up with is the team configuration audit. So you will be able to see that kind of information in terms of who's changed what particular config and what it was before and what it is now. And the next ones that we will be enabling will be teams and admin, and as well as staff auditing capabilities. So if there's any changes in staff table, you can keep track of what's going on and what changes were made. Last up on the list is a follow-up SMS. So we've had the SMS report in EMR and in PMS separately for a little bit. And the only SMS history that you could check was basically for appointment SMS. And now we've enabled it in such a way that you can actually select the SMS type and select follow-up to view which follow-up SMS have been sent down for your organization. Because follow-up SMS currently do not or aren't mapped to teams, when you click on follow-up, you'll be able to see a whole list for that particular date range. Now, in PMS, when you run that report, you can only run it based on your login team. But in EMR, you can, when you run the appointment report, you can actually select the team. So there are other options within that SMS dropdown, SMS type dropdown as well. So we are looking at giving you that particular information at some stage. But as of now, we've only enabled appointment SMS and follow-up SMS for you to view in that report. We've got a question here on the chat. So will auditing include ability to ascertain, access, view, printing of records by staff members? So that is auditing within the client record, and we do have some of that now. So we've introduced the ability to audit documents already. So I believe that was made available in 796. So if someone opens a document, you can actually see whether they've opened it and viewed it, or if they've modified it, or if they've deleted it, or any of those. So that is something that is within the client record. Right, good. And so that brings me to the end of my presentation here. I'm happy to take any questions, but feel free to reach out to our support staff. We'll be more than happy to help you out. And if they don't have the answers, they can reach out to me and I'll give you a little bit more information if needed. And I've been recording this session, so that will be made available to you. And this slide deck will also be available on slide deck shortly. So if anyone has any questions, any concerns, any comments? Hot topic, Lisa, with the release notes. We are working on them. They'll be made available shortly. I'll see what I can do for you. We can release some of the notes that we've completed till now, so at least you have some idea of what's coming.
Okay, thank you.
No worries. I've got another question from Rumula. Does that mean there'll be improvements with what gets to DBO audit log? At the moment, it's not that granular. We're creating separate tables for admin client auditing, as I mentioned, because it's separate from the client audit information. There will be different reports and tables for that. I see someone's hands up, but I can't actually. Nick.
Hi, it's Nick from Adelaide PHN. Hopefully you can hear me.
Yes.
Did I hear you correctly in saying that we'll be able to see all messages in the SMS viewer across all teams?
For follow-up, yes.
For follow-up, okay. Is there any option to customize that? Because Adelaide PHN's in a situation where we have multiple organizations using our MasterCare instance, and we use Teams as the way of separating out their access. And we basically, we can't deploy version 8 if that's the case, because it would constitute a potential data breach.
Okay, yep, we can have a chat after this break. And Nick, I'll get back to you on that. All right. Any other questions? Anthony? There we go. Next.
Yeah, just a question just regarding the appointment booking that's integrated with HotHealth. Is that something that's either fully on or fully off, or is there an opportunity just to send a link for clients to, I suppose, seek an additional appointment whenever it's required?
At this point in time, it will be fully on or off. We are looking into adding additional business rules around them, so you can sort of restrict based on whether this is an existing client or if it's only for specific staff, and things like that. But it's at this point, it's either on or off.
Okay, thanks.
No worries. Got a question here on chat. So what is the ETA for version 8? We will be releasing version 8 at the end of this month. So it will become available to clients who want to upgrade from June onwards. So we're hoping to upgrade some of our MDS clients first, clients who report to various MDS, because obviously for the new financial year changes, they would want to go first and start recording information from 1st July onwards, so they can report directly from EMR. But yes, version 8 will be available from June onwards. Okay, seems to have quietened down a little bit. So if you don't have any more questions or any comments or concerns, I'll let you all go. And again, this recording will be made available as well as the slide deck, and I'll reach out to you. I know, Nick, you've had that question for APHN, and Sujiva for the changes to Headspace, and I'll reach out to both of you separately on that one. All right, thank you, everyone, and have a good rest of your day.
Thank you.
Thank you.
Thanks.
Thank you.
Yeah.
Hey, Oosh.
Hi, Peter.
Just
Do you have a question?
yeah, it's just specifically MHC. So I was just waiting until everyone were kind of settled. Everyone tunes out and jumps in the side. I'll grab you while we're still here.
Sure, I see a few more folks on here if you've got any questions.
No, it's just because we've already got MFA implemented.
Yeah.
I noted that you mentioned setting up a new service. I was just like, hang on, what? Do we need to go through and do that? It's a specific MHC thing.
Yeah. So because you've already got 2FA, you need, when you go live with version 8, you need to set up 2 services instead of just the one. And we decided to keep 2 of them separate, just in case if there's an issue with one, at least the other one's still running.
Yeah, I know. Yeah. I think you could probably, I think the development team can probably blame me for splitting the queue. I think I started that one. No, that's cool. I just wanted to understand just the sort of the practicality of that. That's all. But no, I'll check in with Fiona in due course and we'll wrap our head around it. All right, You're amazing. Thank you for your help.
No worries. Thanks, Peter. I see there's Ray and Ali on here as well if you have any questions or if you're just hanging about to see what's going on.
Oh, hi there. Hello.
Hi, Ray.
Oh,
Yes.
Are you recording still?
Yes.
Oh, you can turn it off. It's okay.
All right.
Just a quick question.